According to the American Heart Association, cardiovascular disease remains the leading cause of death globally and in the U.S., with heart failure being a primary driver of this burden, accounting for 22% of all U.S. heart disease deaths. Additionally, heart failure affects over 6 million adults in the U.S. and remains one of the leading causes of hospitalization in adults over the age of 65. One of the late signs of heart failure exacerbation is dyspnea and weight gain. By the time patients present to the emergency department, elevated cardio filling pressures, such as pulmonary artery pressure and central venous pressure, have likely already been present for days, even weeks. Today, I'll be discussing the implantable pulmonary artery pressure monitoring, specifically focusing on the CardioMEMS system. This device is a form of remote hemodynamic monitoring that has significantly changed how we as providers manage chronic heart failure. The CardioMEMS device is a small wireless sensor implanted via right heart catheterization into the distal pulmonary artery. Once implanted, the device continuously measures pulmonary artery pressures and transmits daily readings wirelessly. These readings are transmitted via an electric pillow from the convenience of the patient's home to a secure cloud-based platform. Providers are able to review the transmitted pressure readings remotely to aid in the management of those with heart failure. Rather than relying solely on patient-reported symptoms or intermittent lab work, objective hemodynamic data can help guide titration of medications. The changes seen in pressures will allow for providers to adjust diuretics, optimize therapy, and intervene early. This intervention could prevent full clinical decompensation. CardioMEMS allows for real-time physiologic data integration to populate and be viewable instantaneously. Data is then transmitted and incorporated into electronic health record workflows to allow for effortless documentation. Other tools have been embedded into the workflows to allow providers to track trends, set alert thresholds, and allow for prioritization of high-risk patients. This device has shown to decrease heart failure patients' hospitalization rate by up to 28%. This technology supports reducing costly readmissions along with improving chronic disease management. Challenges associated with CardioMEMS system includes cost of implantation and maintenance, accessibility to a specialty cardiology center, reliable electricity at home, health literature, and daily patient engagement. Additionally, patients may become anxious from seeing their hemodynamic pressure fluctuate, or they may begin to rely solely on the device's measurements instead of their own symptom awareness. It would be really important for the provider to provide in-depth education on what to expect with this device. Despite the challenges, implantable pulmonary artery monitoring fills a critical gap in management of heart failure. Without this technology, clinicians often respond only after symptoms have been reported and become unmanageable by the patient. This device enables proactive data-driven intervention before admission to a hospital becomes unavoidable. In conclusion, the CardioMEMS represents a transformative remote monitoring tool that allows for improved clinical outcomes, reduced hospitalizations, and the advancement in technology-based cardiovascular care.